How do I care for someone after deep brain stimulation, DBS? Caring for someone after deep brain stimulation surgery, especially for Parkinson's disease, requires attention to both their physical recovery and ongoing management of symptoms. DBS is a surgical treatment that helps control motor symptoms but does not cure Parkinson's disease, making comprehensive care essential. Immediately after surgery, it is important to keep the surgical wound clean and dry. If there is a dressing on the wound, it should stay in place until the follow-up appointment with the healthcare provider. Avoid getting the area wet to prevent infection. Monitor closely for signs of complications, such as increased redness, swelling, drainage, or bleeding at the wound site. Also, watch for fever, persistent headaches, vomiting, lethargy, or new neurological symptoms like changes in speech, vision, or seizures. These requiring immediate medical attention. If there are concerns about breathing difficulties or persistent pain, contact the medical team promptly. The DBS device is typically turned on about for weeks after surgery during a programming session with the neurologist. Initial settings are low and gradually adjusted over several visits to optimize symptom control. It may take several months and multiple programming sessions to find the best settings, so patience is important. Caregivers should know how to use the patient programmer to turn off the device in urgent situations if needed. The neurostimulator battery usually requires daily charging or monitoring, as instructed by the healthcare team. Some patients may experience temporary confusion or cognitive changes after surgery, especially older adults and those with Parkinson's disease. During this period, increased assistance with daily activities may be necessary. To reduce confusion and support recovery, maintain a consistent daily routine. Ensure medications are taken exactly as prescribed without skipping or altering doses. Encourage gentle physical activity, such as walking, to promote rehabilitation. Monitor for any worsening of movement symptoms or new movement issues like dystonia or tremors, and report these to the medical team. Regular communication with the neurologist and DBS team is vital for ongoing adjustments and management. Be prepared to contact the neuromovement disorder specialist or neurologist on call if urgent issues arise. Attend all scheduled follow-up appointments for wound checks, device programming, and overall assessment. Planning for additional support at home in the first weeks after surgery is important, especially if the patient lives alone. Keep emergency contact numbers for the DBS care team readily available. Educate yourself about the DBS system and symptoms that requiring urgent care. Encourage and support the patient's adherence to medication and therapy plans. In summary, caring for someone after DBS involves vigilant wound care, monitoring for complications, supporting gradual adjustment to the stimulation device, managing potential cognitive changes, and maintaining close coordination with healthcare providers. This comprehensive approach helps maximize the benefits of DBS for Parkinson's disease while ensuring patient safety and well-being.